A 59-year-old woman comes to the office due to progressive fatigue and occasional heart palpitations over the last 6 months. The patient has been under a lot of stress recently due to problems at work. She has no dietary restrictions, eats out at restaurants frequently, and drinks 2 or 3 cans of beer on the weekends. The patient is postmenopausal and has not noticed any uterine bleeding, dark stools, or bleeding with bowel movements. Her BMI is 25 kg per square meter. Hemoglobin is 8.5 gram per deciliter. Peripheral blood smear reveals pale, microcytic erythrocytes. The question is, which of the following is the most likely underlying cause of this patient's abnormal laboratory findings? Your options are A. Drug abuse, B. Hematologic malignancy, C. Hemolysis, D. Liver disease, E. Occult blood loss, F. Poor nutrition. If you know the answer, click the like button, and if you don't know the answer, keep watching before you fail. The correct answer is E. Occult blood loss. Fatigue and heart palpitations are common manifestations of all forms of anemia. This patient's peripheral smear findings indicate hypochromic, microcytic anemia, which most often arises in the setting of iron deficiency. The primary and most dangerous, if overlooked, mechanism of iron deficiency is blood loss, and it should be excluded first. Women of childbearing age are commonly iron deficient due to menstruation. Men, especially over the age of 60, or postmenopausal women have no physiologic reason to be iron deficient and therefore should be evaluated for blood loss in the gastrointestinal tract. Example, due to malignancy, GI blood loss is often occult, so the lack of dark or bright red stools in this patient should not rule out GI hemorrhage. Iron studies, including ferritin, should be obtained, and the patient will likely require endoscopic evaluation. Do you even know your mistake now? If you are still confused, let me show you why the other choices are not correct. Choice A is incorrect because ingestion of the more commonly abused drugs is not associated with microcytic anemia. Choice B is also incorrect because hematologic malignancies, such as leukemia, lymphoma, multiple myeloma, tend to be associated with normochromic, normocytic anemia. The decrease in erythropoiesis seen in these patients results from hypersplenism or tumor replacement of bone marrow mass. Choice C cannot be the answer because hemolysis often presents with a normochromic, normocytic anemia. Spherocytes or schistocytes are often seen on peripheral blood smear. Choice D is a wrong answer because the anemia of chronic liver disease is usually normocytic or slightly macrocytic with target cells on the peripheral blood smear. Microcytic anemia occurs in less than 25% of cases, and most patients have only mild anemia with a hemoglobin level of 10 to 11 gram per deciliter. Choice F is incorrect answer because this patient has a normal BMI and no factors predisposing her to malnutrition. Example, dietary restrictions, chronic alcoholism. A normal Western diet provides 6 mg of iron for every 1,000 calories, and the recommended intake for individuals age greater than 50 is 8 mg per day. As a result, men and postmenopausal women, such that, not menstruating, pregnant, or lactating, usually have no dietary iron shortage. If your answer was correct, you have our permission to subscribe and continue to the next case.